Hi, everybody. Thank you so much for tuning in. My name is Kimberly Levitt. I'm the Health Programs and Supportive Services Manager at Bradbury-Sullivan LGBT Community Center in Allentown. And I have the honor of being joined today by Karen Williams. Round of applause. Thank you so much for being here. We are so happy that you've joined us. Like I said, we have some fans here on staff, and I'm sure people who are tuning in are also really big fans. To provide a little bit of background, if you're not familiar with Karen's work, she's a comic, she's an actor, a writer, an inspirational lecturer. This is going to be a much longer bio than mine.
You don't have to read the whole bio, please don't.
So her HaHa Institute attracts clients from the public and private sectors. She's an entertainer. You have done things from San Francisco to South Beach to Sydney, where you've performed shows at the Belvoir Street Theatre in Australia. You had the opportunity to go on some Olivia travel, which I would love to hear more about at another time. You were featured in We're Funny That Way, the hilarious internationally acclaimed film at Buddies and Bad Times in Toronto, and shown regularly on HBO, as well as a nominee for the 1999 Glamma Award. And of course, the most importantly, you are the first openly lesbian Black comic in the United States to include specifically lesbian material in her act. So thank you so much for being here. You are, you've done so much.
Yes.
And so today, really what we're going to dive into is talking about COVID. COVID. It's been the main topic of conversation in everyone's lives for the past 14 months. And it's still important to talk about because it's still out there. So I'm just going to jump right in and ask you, what the hell happened last year?
I can't tell you. My last live comedy gig was February 29th, a leap year, 2020, at the Villages in Florida. And then after that, just like boom, 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 everything just went away. I really didn't really feel the intensity of what was happening, because even though, there was the announcement, okay, we weren't going to do live gigs and stuff, we surely thought we'd be back by June or July. That's how short-sighted we are as human beings, right? Here's a global pandemic. We thought, okay, well, we'll just rest and take it down a notch for a couple of months, and then we'll all be back. And that's not what happened. I have to say, to my credit, I went right on Zoom. I mean, I just said, I want to be of service. People were losing their jobs. People were losing their minds. Stress was up, anxiety, depression. And I said, here's my opportunity with my HaHa Institute, which is the International Institute of Humor and Healing Arts, to be of service. And one of the main workshops that I do is humor and healing. I also do humor and stress management. And so people were just calling me, and I was just doing stuff. And I really felt as though this is my opportunity to really kind of just help people cope with something that was beyond our control, to be honest.
Yeah. And I'm sure you had a ton of calls because people were just like grasping and like just needing that relief from like you said, the anxiety, the isolation. I mean, we went from enjoying just our day-to-day to being like completely isolated.
Right. And buying, 200 rolls of toilet paper where you could. We forget about the toilet paper frenzy. I was like, if you need that much toilet paper, you probably need another type of health examination.
So true. That's so funny you say that, because I think my wife and I just had to restock after like a year. It's been like a year since we bought toilet paper.
Oh, that's insane. That's insane. So Suzanne Westenhofer, another comic, she said, she said, I have 164 rolls of toilet paper. I was like, okay, well, that's overshare.
You like open every cupboard, there's like toilet paper.
People buying canned goods and water like crazy. And, it's America, honey. We don't have to worry like that.
Amazing. So personally, how was really that experience for you? Like, as someone who is just creative and artistic, how were you able to cope with just being isolated and not being able to see people or be up on stage or anything like that?
I think it took a while for it to hit me that it was going to be some time before I was live on stage again. I think the other part about it, which I shared in another interview, is I lived through the AIDS pandemic in San Francisco. And although that was very different in so many different ways, I think that just the way that my own activism was stirred during that pandemic, I again felt my activism coming to the fore for me, because we can talk about the past administration all we want, but in the 80s, we had Ronald Reagan, who did not mention HIV or AIDS for 8 years. And so I got a chance to watch gay men in particular rally around their own health and their own well-being, and, turn that into dollars that could save their lives. So, in that way, I think I just have that kind of belief in human resiliency, that no matter what happens, we're going to find a way to get through it. What's more disturbing to me now is this language that's being framed that people don't want to work because they're getting government handouts. Give me a break with that one, okay? Because if you paid people a fair wage, $300 a week extra wouldn't seem like this handout that they're getting. So we have deeper issues around that, but that'll probably be a whole different show.
Yeah, that's a whole other recording. So I guess my next thing that I'm just really curious is, what were some things or activities or cooking habits or what have you that you did or didn't do while you were stuck in quarantine at home?
Well, the interesting thing about me is I didn't really feel that stuck. I got it that other people felt stuck. My mother moved near me here in Ohio from Rochester, New York, about 3 years ago. So I could see where more of the older seniors really felt really kind of trapped, because she was going to like the senior center and, had playing games and doing arts and crafts and doing different things that then she became very, very isolated. But I think
Sure.
because of her being around me, it kind of gave me a different view of the whole COVID-19 pandemic anyway, and spurred me on, I'm sure you're going to ask me about that, but move me towards the vaccine probably quicker than most, because if you remember, when the first information was coming out, it was people over 60. It was definitely seniors who were being targeted. It was certainly after that people of color. So I was just checking off the boxes, and
You're like,
so I need to be in good health,
Exactly. Yeah, I mean, I'm definitely gonna ask you some questions, and I'm curious, just about the vaccine specifically for the LGBT community. Some of the work we do at Bradbury-Sullivan is not only are we offering, or we were offering the vaccine here at our center to LGBT specific, LGBT people specifically. We're just trying to educate people the best that we can to make sure that we stop the spread. So I just wanted
to. The spread we couldn't stop was the other spread. My doctor said people were gaining 2 pounds a month. And when you ask about what habits changed for me, I was right along with the rest of America, eating and eating some more. So of course now I'm exercising some more just to get it all off. But yeah,
alcohol companies didn't suffer at all. Grocery stores were completely fine. So I just wanted to share just some information that we've gathered here, and some reports just regarding COVID and the LGBT community. So this is a report from KFF. They said most LGBT adults say they or a member of their household lost their job during COVID. 3/4 of LGBT people say they worry and stress a lot from the pandemic, which has had a really negative impact on their public health, and we kind of are on their mental health. So, and we touched on that a little bit. And LGBT people are about as eager to get vaccinated as other Americans, but more view it as a part of everyone's responsibility to protect the public rather than a personal choice. And I think that last one, I think it resonates with both of us. I feel like I can say, I feel like people, some people view it as a responsibility and other people view it a little bit differently. But what I like to think is that the vaccine is kind of like a pair of shoes or a pair of socks. Like you don't only need one, you need two, right? So you need to get both, and you need to get them from the same place. You can't have like not matching shoes. So, you know, I would love to hear your opinion and like some of the things that you feel about people who are just ultimately vaccines hesitant,
Well,
specifically,
it
you know,
was,
specifically LGBT people or lesbians and people that identify like we do.
yeah, most of my world is LGBT. So, most of the time I can speak in that context. However, I had a son living with me who was a demasker and an anti-vaxxer. So that was very, very challenging. He's in his late 30s. I literally asked him not to be here because I did not want to have that risk hanging over my head for myself and also for my mom. And so eventually what came around is that he began to wear masks around us and wash his hands and, just try to be that a little bit more respectful, regardless of how he was feeling about that. And I think that that's the issue that comes to the fore is, yes, there are so many things that as Americans, we value our freedom to be able to do. And then there's something called responsibility to your, you know, fellow and sister human, since we're sharing this planet here together. And I made lots of jokes about my boomer generation. We ingested all kinds of formulas, chemicals, drugs, drinks, and other doodad items that we knew nothing about what was in them.
Right.
I know for a
Right.
fact that I had friends you could give something and they would say, "Oh, I think this is blue dot. I'm not really sure, but and now all of a sudden my generation has a headache and doesn't want to take an aspirin.
Right.
So, what's in that vaccine? How long has it been? It just happened too quickly. No, it didn't. Do your research. President
Exactly.
Obama knew that after SARS and his team, I'm not saying him personally, but his team around him had made preparations for another pandemic to occur after the whole incident with SARS. And so just the making of the devil of Dr. Fauci and all the other conspiracy theorists that were just jumping around, yelling and screaming. It's unfortunate that our community, LGBTQICA, I hope no one else comes out, but our community tends to be a vulnerable community anyway.
Right.
Because it would be to say that we only have one challenge in our lives, and that's just not true. I'm sure in the work that you do, you find out, like you said, people are afraid of losing their jobs. Many times we have to caretake other people. Many times we are not in the higher echelons of earning power. People have lots of health issues. There are a lot of issues that impact us as LGBT people. And so I just feel like it's really a responsibility that I have, as a member of this community and also a member of our society to, be as up to date with information and to get the vaccine.
Sure. Yeah, absolutely. And I completely agree. I think this is just another added layer, a potential barrier, another disparity that's kind of just layered on top of the cake.
Yes.
And I completely agree with everything you said.
Mhm.
In terms of some of the, skit work that you're doing or anything like that, like has it been completely COVID related or are you
Oh,
trying?
no, no, no. I really don't do a lot about COVID because I think that what really happened is we just saw so many schisms occurring. And then the last thing that we need in this country are any more divisions. I mean, we had a coup, for goodness sakes. I mean, if that had happened in another country, we would have rushed in, and with and done all kinds of things. But the fact that it happened here in this country, we've just been through so much that I really try in my comedy work to bring people together. We don't need any more divisiveness.
Sure, sure. Um, so how, so it's fortunate that the United States has come so far in terms of people, in the percentage of people getting the vaccine. I know it's different in every state,
Mhm.
but country-wise, we're doing okay compared to the rest of the world. But I guess my biggest concern is how we will react if we need a booster shot. Is that something that you've thought about,
No,
or?
not at all. I wasn't even aware about a booster shot. What does that mean?
So after a period, so for example, we get our 2 COVID vaccines, and after a period of time, the antibodies aren't as effective anymore, and we might need to get another shot to make sure
Right.
that we are safe. Can you imagine how the country or people are going to feel if we need a booster shot, or those who are anti-vaxxers are extremely hesitant? Like, can you imagine, you know, what people might say if they need to get something else?
I'm from that generation that, took the polio vaccine on a cube of sugar. I
Right.
mean, I don't think we just did it once. You know what I mean? And
Hmm.
so I just don't have that short range view about my health and health protection. I'm not naturally suspicious in that way. Most of us have survived pharmaceuticals that if you read the side effects, you would never take them. You know what I'm saying? And so, but yet, for mental health reasons, we take these things to maintain our control over diseases like diabetes. Um, People, I'm sure that medical journals in the future are going to look at our health system and say, did they really burn people up from the inside to fight cancer? You know, because we don't give people lobotomies anymore who have migraines.
Right.
We're an evolutionary species, and so some of us go along with the evolution of science and of protecting one another as humans and seeing that as a sense of responsibility, and other people, I guess, just don't do it.
Yeah.
I just did not want to be engaged in really. I had people who work in health departments who have
Mhm.
multiple degrees tell me that completely demonize everything that Dr. Fauci said, and it would
Right.
be so mind-blowing for me. I had to decide that I just can't listen to that stuff.
Mhm.
That if that's the choice that they want to make, and for many of those people, they were not around older people, or they
Right.
were not around people who are compromised.
You're like, I just hope that guy just like steps in a puddle or something and just has a terrible day.
It's just like, I don't really know what to say. There's so many. I mean, and just think about it. At the same time that we've been engaged in dealing with a global pandemic, we've had, George Floyd. We've had incidents in this country that are definitely turning the tide around social responsibility.
Sure.
And while the COVID conspiracy theories were flying, so were all the other pink shoes matter, just to diminish the
Mhm.
importance of Black lives matters. I mean, there's
Right.
been all kinds of pushback in so many different areas that it's like pick an area, you know?
Exactly.
Yeah.
Exactly. It's definitely like this last 14 months has really shed a lot of light on a lot of things that really just bubbled to the surface really quickly.
Yes.
Um, no, absolutely. So you mentioned that you lived with someone who is not interested in getting the vaccine, who didn't want to wear a mask. Um, what advice would you give someone who is, hesitant to get the vaccine or wants to walk around without a mask? I know at this point, mask mandates are shifting a lot.
Mhm.
Um, but how was that for you? And because you're just trying to be safe for yourself, for your family.
Well, I think that it's the natural proclivity of us as humans to try to appeal to someone's sanity and to appeal to their common sense, to appeal to their levels of social responsibility. But then after a while, especially since I'm the mom and you were living here rent free, you have to go. It's just, I mean, at the end of the day, you can't put me at risk, and
Yeah.
that's the way I perceived it. And until you can come up with some other perceptions that I could follow, I just had to, tough love you just right on out of here. So
Yeah.
I'm sure a lot of people had to do that, because I have the feeling that a lot of people, just like we LGBT people hang out with each other, I think the anti-vaxxers and
That's
those
very
people,
true.
they were hanging out with each other, because there were bars and clubs around Cleveland. A couple of times I dropped my son off and you wouldn't have thought that there was a pandemic at all.
Right.
People were on the patios. The mythology was that if you're outside, there was no problem, and people believe that. So it just was tough.
Yeah, I'm sure. In this, so where I am in the state of Pennsylvania, they are lifting the mask mandate for those who are not vaccinated at the end of this month. So, so that will be lifted, I believe at the end of June. And so it's kind of creating a gray area right now of, I'm finding, where do I wear a mask? Where do I not wear a mask? I actually went to a yoga class earlier this week, and recently someone came in demanding that everyone wears a mask, even though that wasn't the policy at the yoga studio. And then, she just left. She was like, if not everyone's wearing a mask, then I'm not going to be here. So I think we're going to see a struggle like that for a while
Well, you're
of,
brave,
people.
because I do yoga and I won't go to a class yet.
But I think, well, that was my first time back in person.
Yeah,
Um,
I still do it
but
at
I
home
think
on the Zoom.
I think that I think it's just going to be. I'm realizing really quickly there's just such a gray area for folk
Yeah.
of what they're comfortable with, what they're not comfortable with. Some grocery stores are saying wear a mask. Some grocery stores are saying not to wear a mask. So I think it's actually frustrating because I don't know what to do, or which way to turn. So I think we're going to see that for a really long time.
I'm just going to protect myself. So I feel comfortable wearing a mask anywhere where other people are. And as a person who logged in over 30 years on the road and used to see Asian people in particular wearing masks, when I went to Japan, 1 in 3 people wore a mask.
Right.
And to find out that this last flu season, flu was down 98%.
Yeah, I know.
Because we're like, wear a mask. Like, I might wear a mask everywhere now. I mean,
I
I
know.
don't, I just will be a masker.
Yeah. No, you are so right. I know.
And on planes, are you kidding me? I'm wearing a mask. On a plane, if someone coughs, you look at them now. I just was on a flight 2 weeks ago. People don't even clear their throats. I mean, it's like,
Yeah.
no,
I know people are just like robots. They're just like,
no one's making any noises at all. So, and almost everybody was wearing a mask. So I think that's going to be
right.
the way it is for a while.
Yeah, you can't even drink water on an airplane. It's such a commotion. Well, is there anything else that you wanted to share or add, or just any final?
I would just really like to say that, as LGBT people, we have really struggled to find our place and to really have people really regard us with respect and to live our lives with dignity. I think those are the biggest things that we have really wanted for ourselves. We're past acceptance, tolerance, all that kind of stuff. We have our place in society. And I think that part of what we can do is to uphold our own dignity and our own self-respect and really see ourselves not just as LGBT people, but also as just viable citizens of the world. I view myself as a world citizen. This was a global pandemic. And we lost a tremendous amount of lives here in the United States. And I am not excited yet with the numbers of people who have gotten vaccinated. It's better, but it's still not enough. And I would just like to encourage any of us who feel any sense of responsibility about our own health, and then also the sanctity of other people's health and other people's lives, to please do what you can to get vaccinated.
Yeah, thank you so much for sharing all that. That's perfect closing words. My final question, which has nothing to do with anything we've talked about. Do you feel like you've really been affected because your name is Karen?
No, not at all. People have asked me that, but I just ignore it. I don't even know what that was about.
Okay.
It's just weird.
That's fair enough.
Yeah, it's just weird to me. I just didn't pay it any attention.
All right. Well, thank you.
It's the name of the 50s. It was a very popular name in the 50s. So there's lots of.
There's nothing you can do about it now. Well, thank you so much for joining me today. It was wonderful chatting with you. And for everyone listening, If you would like to learn more about how to continue staying safe or having questions about COVID, the COVID vaccine, you can visit bradburysullivancenter.org/coronavirus. And I also wanted to remind folks that Lehigh Valley Pride is taking place in person this year on August 15th. And you can also find out more on our website.
And
So
I'm putting in the chat, womenonthenet.net. They're showing, there's going to be a showing of my comedy special on Sunday at 7 o'clock Eastern Standard Time. I Need a Snack. So if any of your people out there are interested, they can go on that site and take a look at the video.
That sounds great. Thank you so much.
Thank you.
All right, everybody. Have a great day.
Thank you so much.